Hey, this is Dr. Lewis at Chiro Plus in Jackson, Tennessee, and we have Mr. William with us today. And Mr. William comes in with pretty severe low back pain. Not at the moment, but about 2 weeks ago, he was having some pretty good pain. He did try, muscle relaxers and steroid shots, or not steroid shot, but oral steroid medication, and some ibuprofen, and that did help. But then it kind of came back a little bit later, so we're going to kind of show him what it feels like to be decompressed fully and hopefully get him some relief. So go ahead and lay on your stomach for me. Mr. Williams' job involves a lot of sitting, and so we all know that that is not good on your back. Is that tighten up in your low back at all? Yeah. You can go ahead, you can put your hands right there if you want to. So Mr. Williams has never been to a chiropractor before, so we're excited that we get to show him what it's all about. So Mr. Williams, I'm gonna have you keep your legs straight, raise it as high as you can for me. Okay, drop it. Now just do the right one. Drop it. Now do the left one. Drop it. Is that one, the left one still? Yeah. So here's what we're gonna do. First thing I'm gonna do is a little soft tissue work. So I'm just gonna use this massage gun type thing. Try to work these muscles. So what brought on his pain was he was moving some furniture, some appliances around, picked it up, and that kind of brought on his back pain. So that's pretty typical with people that experience back pain. It's usually don't just wake up with it. There's usually some sort of an instance that brings it about. And a lot of it is just repetitive micro traumas from sitting, from work, from doing daily activities that just kind of build upon one another. Is that tender?
Yeah.
Yeah. All right, raise this left leg again for me. Drop it. One more time. Drop it. One more time. Drop it. Good. So I really want to work on these glute muscles right here, they're the main hip extensors. So if we get these to loosen up a little bit, they can become stronger. Good. Alright, so now I want to have you cross this left leg over the right. Actually, just kind of like that. Perfect. Now you're gonna feel this table pop up like that, right? Okay. And then it's gonna drop like that. So we're gonna adjust your left SI joint first. So you're gonna feel a little drop right here. Okay, here we go. Good. Okay, uncross there. Now we're gonna work on your sacrum, your tailbone. And then your right SI joint. Okay, try to raise that left leg again for me. Drop it. Does that feel any easier?
Yeah.
Try the right side again. Good, good. All right, so this next thing is a little jackhammer. That's how I like to describe it. You're just gonna feel that we're gonna go up your back with it. This just helps to put motion in the joints. Okay. Let's check it out here. It's even. Now, does that feel any looser at all?
Yeah, maybe some.
Yeah. Good. So the next three might be a little tender. So we're going to do L5. So this is going to be a straight drop right here. Here's L4. And then up to L3. All right, so you just keep breathing normally. Good. Doing okay?
Yeah.
Good. Good. Give me a big deep breath all the way out. Good. Gonna work up to here. Good deal. Does that feel okay?
Mm-hmm.
Good. All right, lay on your back for me. So, relax this leg. Now you're gonna feel this in the knee and up in the hip, maybe in the ankle as well.
Okay.
We're just gonna do a little distraction on this hip. So let that relax. There you go. Good deal. Same thing over here. Let that relax. Good deal. All right, I'm gonna have you sit up here. Swing to your left. Oh, sorry, other way. You're good. You're good. All right. Look left for me. Look right. Good. Look straight. Okay, so we're gonna work on this neck a little bit. Go left. Come back right. Left. Look straight. Now we're gonna go back. Look down. And go back. Look straight. Okay. Go left for me. Go right. Good deal. Look straight. Never injured your shoulders before, have you?
No.
Good. So we're gonna adjust these. So let that bend right there. And let that drop. Perfect. Okay, let it drop. Good. Perfect. Let that drop a little bit. Good. Now check your elbows out. You ever had your elbow adjusted? Kind of different feeling. Good. All right, come on over here. So how this table works, this is the manual decompression. So you're gonna sit here, lay on your back, and the legs are gonna go that way. Perfect. So this is kind of ideally how you should sleep.
Yeah.
Flat on your back, no pillow, and then your legs are gonna be elevated to about 90 degrees if you can get on that way. Best thing you can do is get a like a laundry basket, kind of flip it up. That's one of the easiest ways to kind of achieve this. Scoot down this way a little bit more. Perfect, perfect. And it should feel pretty comfortable. It should kind of take that pressure off your low back a little bit. So we're gonna check your reflexes here. Good. So the pins are gonna feel kind of go on either side of your hip here. It's gonna feel tight. It should though. Good. All right, put your hands right here for me. Now, on this, lift your head up a little bit. Okay, drop it. Keep your teeth together, and I want you to blow out all the way through your nose, okay? Give me a big, deep breath all the way out. Good deal. Now, how far did you feel that?
All the way down.
All the way down. Yeah, it's a big adjustment on the first time. It didn't hurt though, did it?
No.
Yeah, good. That's one of the best ways to adjust that low back. It actually is the best way that I have found. So now we're gonna work on your neck, okay? So we're gonna do a little, so just bend it. Perfect. And then we're gonna do this side.
Good deal.
Feel okay?
Mm-hmm.
Awesome. So for your first chiropractic experience, this is kind of a big. This is not your. What I like to tell people is, we talked about it a little bit in the consultation. You said you're almost 40, so you've had 40 years of compression, and to get that fully decompressed is kind of a big feeling. Let me help you sit up here. Awesome. Swing this way. So, how would you? It's hard to explain till you get it done. What does it feel like to you? Do you feel like it achieved of getting that low back? Adjusted.
Feels better at the moment, for sure.
Good. And one of the things is you will be sore from this for about 48 hours. So water intake is going to be key. That's going to help hydrate your muscles, keep them from getting tight, as well as ice. I know heat's fine too. Ice, do your combination: ice, heat, that sort of thing. And then along with the stretches, of course, that I showed you. So, it's nothing to be afraid of, and it works very well.
Yeah.
So, if you need a good chiropractor, we'd love to help you at 731-736-4200, or visit us at chiroplusjackson.com. I think you scheduled online.
I did. Yes.
It's very easy to do. So, anyways, y'all have a good day.